Connecticut's budget is short on money for Medicaid, and one of the reasons, a recent policy giving insurance to undocumented children.
NBC Connecticut political reporter Mike Savino joins us live from Hartford. So, Mike, how much of a shortage are we talking about here?
Well, Amber and Kevin, we know the total deficit for our Medicaid expenditures right now is looking like it's going to be about $220 million, but we don't know how much of that is because of this specific policy. But Republicans aren't waiting on that answer to say we should scale it back.
All of that impacts our state budget.
Republicans are questioning how much Connecticut spends on undocumented immigrants. For starters, insurance coverage for undocumented children 15 and under is one of the drivers of a $220 million deficit for Medicaid.
The challenge with that is they live in our state. They're going to get ill. They're going to get sick.
Democrats say the insurance avoids more costly medical care should those immigrants go to an emergency room. But it's also putting the spotlight on the cost of services for undocumented immigrants. Estimates vary wildly, and the state has never attempted its own estimate. Still, people we talked with support these policies.
If we're benefiting the people that need it most, we are benefiting all of society.
I personally believe healthcare should be provided for everyone.
Some do see a limit.
However, I do see what people might be talking about where it's gone to a point where they might want to draw back a little bit.
Democrats could revisit a proposal to expand Medicaid and cover undocumented immigrants up to the age of 18.
I think there are members of the legislature who are still committed to continuing to gradually raise that age.
Governor Ned Lamont thinks we should pause.
Let's take a look at how we're doing on that front.
And Republicans say this policy takes away from other priorities.
And that's what the Democrats have done. They have prioritized this immigrant population over their own residents.
Now, Lamont's budget office does hope to have a number on the cost of this policy sometime in January. But one of the big holdups, they're still trying to figure out how many of these children on Medicaid do actually have legal status, which would qualify them for a federal reimbursement. Connecticut does, however, cover the cost of those who are covered who are not documented. Live from the Capitol, Mike Savino, NBC Connecticut News.